Hello, I'm Cynthia Scott Traeger, and this is a very brief introduction to best practices for data citation and data sharing in the health sciences. I wanted to start off with this quote from a report put together by the International Council for Sciences Committee on Data for Science and Technology and the International Council for Scientific and Technical Information. They issued this jointly as a task group on data citation standards and practices. And this particular quote comes from the preface, and I think it really sets the tone for some of the issues we'll be considering in this video. They stated that, and I'm sure you've already noticed this within your own fields, the growth in the capacity of the research community to collect and distribute data presents huge opportunities. It's already transforming old methods of scientific research and permitting the creation of new ones. However, the exploitation of these opportunities depends upon more than computing power, storage, and network connectivity. Among the promises of our growing universe of online digital data are the ability to integrate data into new forms of scholarly publishing, to allow peer examination and review of conclusions or analysis of experimental and observational data, and the ability for subsequent researchers to make new analyses of the same data, including their combination with other datasets and uses that may have been unanticipated by the original producer or collector. The use of published digital data, like the use of digitally published literature, depends upon the ability to identify, authenticate, locate, access, and interpret them. Data citations provide necessary support for these functions, as well as other functions, such as attribution of credit and establishment of provenance. So there's quite a lot of circumstances that you could encounter as a health scientist. Perhaps you're considering reusing someone else's data or reinterpreting it. So you're looking to discover and use data that's already been generated by somebody else that might be relevant to your own work. Or maybe you've just generated some data in the course of your own work and now you're thinking about sharing it and making it more widely available for someone else to reuse or reinterpret. Maybe you're looking to store your data in a way that's highly discoverable because you hope that someday someone will find and use your data, perhaps in a way and for a purpose that you can't even imagine right now. Maybe you're planning to do some research on a certain topic and you want to be able to see what data already exists and what form it's in and how it was collected so that you're not entirely reinventing the wheel with your own work. Or, on the other hand, maybe sometimes you do want to go back and rehash some work that's been done previously. Maybe you read a paper that was really provocative and really convincing, but you can see something in the raw data, assuming that it's been made available, that then spurs you to see if those results are truly valid and truly replicable. Maybe you want to download that original data set and compare it to your own. So this is a big deal in the health sciences, right? And indeed, the scientific method generally. We know that there can be immense value in the replication of results to confirm conclusions and assumptions. We know that we need to verify, to self-correct, to reveal bad or inadequate science. Of course, unfortunately, this isn't always seen as a terribly glamorous endeavor, and sometimes it's downright difficult, right? So perhaps sharing data more responsibly could make this less difficult. But no matter what sort of circumstance you're confronting, attribution is a key consideration, right? So if you are sharing your data, you presumably want to make sure that your name is attached to your data as being an author of this data, as being the person who did the work or conducted the study that yielded this data in the first place. Or you want to make sure that when you download data and use data that is the product of the work of others, you want to be sure you're citing those people properly and often citing the paper or other publication that was the culmination of their gathering of this data in the first place to put it into context. So when attribution is done well and consistently and efficiently, it really grounds data in a context that could be very useful in the future. Who published this data? Are these people or the institution behind them credible? What was the initial intended use of this data? What has it been used for since? What conclusions have other people been drawing from this data? Where can I find out more about that? If you're able to sort of lay this trail in the form of effective metadata, the usefulness of a dataset can be maintained or perhaps even enhanced. So the ideal, I think, is to have data in easily downloadable formats that can stand alone from any other publication or analysis that has resulted from the data. But the data should never be entirely divorced of context and proper attribution. So this is why it becomes so important to have rich, consistent, searchable, machine-readable metadata. And this, of course, helps to establish provenance and credibility. If data is to be reused or perhaps merged with other data and conclusions are going to be drawn from this, one absolutely has to be able to establish the circumstances of this data's origins. So you need to know the how and why and where it came to be. And if you're ever really on the fence about sharing or not sharing, or reusing or not reusing, always consider sort of the scientific ideal of contribution, consider an ethos of discovery and what you could potentially contribute to this digital ecosystem that stimulates further investigation and future collaboration and reinterpretation. This could all become so, so key as science advances. And the sharing of data and these open data initiatives that you've no doubt heard a bit about already really could open doors to great possibilities down the line. One more point to consider is that, according to a 2013 study about research data management published in the journal Nature by Heather Piwawar, papers that publish datasets get cited more often. It's as simple as that. So, there's always that to consider if a bit of self-interest and the advancement of your own career is a motivating factor at all. Okay, so what are some best practices for citing others' work? Classic APA style has something to say on the matter. They've dictated a standard citation format for this sort of thing, including data sets, which you can see here. The American Medical Association's Manual of Style doesn't actually contain explicit examples of citation formats for datasets like APA does, but the AMA manual does offer up some discussion of ownership and control of data that may be of some use to you. So if that's something that you're interested in, I encourage you to check out the AMA Manual of Style. Crosscite.org is a digital object identification citation formatter. You always want to reference the DOI when you're giving attribution whenever possible, in the hope that anyone who's interested can be pointed directly to the location of the originally uploaded data. So this is often a string or a URL that should persist and help identify the data's origin. Citing Medicine is the U.S. National Library of Medicine style guide for authors, editors, and publishers, and it contains sections pertaining to data, databases, and retrieval systems that you may find useful. And there are many more tips and links available at the UW Health Sciences Library website under the subsection Data Resources in the Health Sciences, and you want to click the yellow tab that says Cite Data. And just as a quick reminder, some best practices for sharing your own data. Obviously, there are going to be certain policies that may govern what you do or don't do with your data. If you're here at the University of Washington, there are University of Washington data policies to be aware of, such as the Grants Information Memorandum 37 on rights in research data, set forth by the UW Office of Research. UW Libraries ResearchWorks has a digital collection policy for archiving scholarly works and research data. And the UW Human Subjects Division has some policies and procedures on research activities using public data sets. Additionally, there are some NIH data sharing requirements that apply if you've got a grant that's over a certain dollar amount, which I believe is $500,000. And of course, the NIH also has some things to say when it comes to confidentiality and the privacy of human subjects data. So there's a publication that the NIH has put out on this topic called Research Repositories, Databases, and the HIPAA Privacy Rule, and links to it, along with the UW policies I just mentioned, are all available at the URL underneath the last bullet point that you see here in the UW Health Sciences LibGuide under the Share Data tab. Also, do consult resources like the Open Data Commons, which walks you through some of the legal aspects of this stuff, like different kinds of licenses, such as public domain, attribution, and open database licenses. And they have something called a 2-minute guide to making your data open, which sums things up really nicely. Just in general, you always want to use open file formats. So CSV files are kind of the gold standard for numerical data. XML can sometimes be a good choice, but you always want something that can be opened by a range of software and applications now and presumably also in the future. Ideally, you'll be uploading your data to a repository that promotes openness, and they'll request that you use an open file format, but even if they don't, it's something to keep in mind. You also want to make sure you're getting a persistent identifier or a DOI, so there's no ambiguity about where your dataset can be located, and citations can always point back to it in the same way. And I just thought it would be nice to close with this quote from the Penton Principles, which can be read in full at pentonprinciples.org. The first draft of these was authored in the summer of 2009 in Cambridge in a pub called the Penton Arms, so that's a charming bit of trivia for you there. And then members of the Open Knowledge Foundation Working Group on Open Data in Science refined them and formally published them in 2010. So these Panton principles are a set of recommendations about how best to publish scientific data in a way that it can be discovered and reused most effectively. And this quote in particular is a sentiment that I wanted to close on. It's the idea that science is based on building on, reusing, and openly criticizing the published body of scientific knowledge. So, for science to effectively function, and for society to reap the full benefits from scientific endeavors, it's crucial that science data be made open. Obviously, if you're very intentional and disciplined in the way that you cite and share data, you're contributing to this open culture, and by allowing your data to be available and perhaps useful to people who may be doing things either in the future or in some other discipline unbeknownst to you, you may be contributing to science in a way that you can scarcely imagine. And that's sort of a lovely and exciting way to think about open data culture, and I hope that you do bear it in mind. And finally, here's a more formal list of all of the resources that I've mentioned in this video, and I will be placing these along with links in the description as well. Thank you so much for listening. I hope this presentation has been informative.